I think one of the exciting parts of the course is that it really challenges the students to think through some of the really big uncertainties that exist in clinical care and on the economic side, and how to put them together. And also to put that economic and clinical information in the context of some ethical decision making. Because when it comes down to it, dealing with the real messiness of everyday life, of clinical care, of people's lives and costs, they're really complicated issues. And I think it's hard to have an appreciation for how to put those pieces together. What's known, what's not known, what the challenges are, what the strengths are. And that's what they learn in this course. So some of them will be exhilarated by the chance to really show off their knowledge, and others will be frustrated by the fact that they have to deal with the realities of things as they transition from a course-based life to the real world in the clinical setting as they do their rotations in the coming years. So this course is about that transition, both in its challenges and its richness.
Okay.
I think my course builds on all the CDM clinical background. It builds on the health policy, the biostats, all that work as well. I think in terms of preparation, it does prepare a pharmacist for the real world, maybe not necessarily in the retail setting, but across all the other settings where you have to make decisions around populations, around managed care, and so forth. And I also think it prepares them for life, because they have to now think about these clinical and economic issues in their own lives, in their families' lives, and so forth. So it's a chance to really reflect on that. They would miss a chance to try to pull it all together. And that's that's part of the capstone part of it. And I think that they'll learn about working in groups. That's the real world. You'll be assigned to projects in the workplace with people you know, but not necessarily know well, and you have to produce things as part of that, whether it be in the retail setting, in the hospital setting, in the ambulatory care setting, across the board. And I think that kind of real world element is a key part of my course. So I think they'd miss that if they didn't take the course. I think it has a lot of implications going forward, because the economic issues are critical to how we deal with the challenges in healthcare. And so it has a lot of implications from a health policy point of view, at a local level, at a state level, at a national level, and even at a worldwide level. And so I think that it affects the practice of pharmacy in terms of really grappling with the issues, because pharmacy is a place that really is at the nexus of how you bring some of these things together. And our pharmacists have opportunities in many roles to really deal with the issues in a major way. It also has implications for research, because you identify the gaps in the literature and the gaps in knowledge that affect what you're doing and what you can do. So that part of it is you can basically, a lot of the projects set forth what needs to be done to fill in these knowledge gaps, both clinically and from an economic point of view.